It can be amazing to work from home. You've got lots of advantages like that second cup of coffee, keeping your PJs on, and being able to multitask maybe a load of laundry in and then getting onto the computer. But with those benefits come risk factors. And these risk factors are generally ergonomic in nature, meaning how you're setting up your workstation. What's important to note for breast cancer survivors is that they are at increased risk from these ergonomic problems when you set up your office. My name is Marian Barnick. I'm a registered kinesiologist and cancer movement therapist. What I've put together for you today on behalf of Rethink Breast Cancer are 7 stretches that are specific for breast cancer survivors who are working from a home office. Won't you join me? A really important stretch for breast cancer patients who are working from home is to stretch the anterior muscles through the pecs and through the front of the shoulders. Not only are you at risk because of general office procedures of working on a laptop, on the phone, on a computer, but you're also at risk post-surgery, post-treatment of having tight pec muscles and having an adopted posture where those shoulders may be rolled forward. So I want you to try this seemingly simple stretch, and I'll give you some pointers. What I want you to do is just grasp your hands behind your tush. I'll show you from the side. Now I know that that looks easy, but here are your pointers for moving well. Ear over shoulder and shoulder over hips when you're in this position. So nothing should move, but you may feel your core engage to hold that position. That's fine. The other thing I don't want you to do when those hands come behind is to lift up or hike those shoulders. If you've ever been doing shoulder shrugs, that may be an adopted position that you're used to, is lifting up the shoulders to move the arms. I don't want you to do that. I want those arms to slide right behind and grasp. So no engagement of those upper trap muscles. Now, as a bonus, if you find that that's easy, those hands behind here, and you're feeling that stretch through the pecs, feeling the stretch through the anterior part of your shoulder, and you're below a 5 on the pain rating scale, then you can take it up a notch. Let me show you. Wonderful stretch for the anterior muscles through the pecs and through the front of the shoulders. If you've ever found yourself sitting at your desk, sitting at the dining room table, or even at the end of the day watching TV and you are grabbing at your neck and you've got aches and pains and it feels like those muscles are swollen, well, they probably are because you've been overusing them. I'm talking about those upper trap muscles that you're probably using if you are raising your arms up to your keyboard that's set too high for you. That's your ergonomic issue. And also, as a breast cancer survivor, if you're used to either doing shrugs to try to move your arms because you've got decreased shoulder range of motion, or because that's become an accommodation that you're naturally doing to reach and move throughout the day. So I want you to stretch out those upper traps. I'm going to show you how, but I want to make sure you do it properly. In order to make sure that you're stretching your upper traps properly, we need to keep the rest of the body in alignment. So I'm looking primarily at the hips and I'm looking at the shoulders as I drop that ear down to the side. Those shoulders should stay even because the muscles I'm stretching are going from the shoulder area up into the neck area, up right behind here and through the head. So if I lift up that shoulder, I'm taking away the benefits of my stretching time. So I want you to make sure when you're leaning, that ear comes down to the shoulders stay even, the hips stay even, and the eyes and the nose stay forward. That chin should not drop. Those eyes should not be moving upward. We want a nice stretch through the upper trap. Another area that can get tight and sore as you're sitting in a chair, as you may even be standing to work, are the sides of our body. We may be lifting up our hips to mobilize. We may have a chair that's too high, so you're tucking your feet up behind. And when you do that, you're lifting up and engaging muscles that come from the pelvis and go up into insertion into your spine. So if you have pain and tightness through the sides of your body or up through the hip into the low back, this is a stretch for you. Again, what I want you to make sure of is that you are maintaining the other positions of your body where they should be so you get the best benefit out of this stretch. So you can do this in sitting or standing. I'll show you in standing. And what I'm doing is I'm leaning to the side. Now you may say, hey, Marian, you know what? That looks pretty easy. I lean to the side all the time. No big deal. But did you see the difference between those two? If I'm leaning to the side and getting that great stretch, I'm keeping my hips even. What you may be doing is leaning to the side and dropping out that hip. You see how that alignment changes? I want you to keep your hips even. So if you're sitting, I want you to keep even pressure on the chair. When I'm standing, my knees are even, my hips are even, and when I lean, I'm just leaning down to the side to stretch through the hip and into the back. If I dip the hip, then I'm losing the area that I really want to stretch. So keep your hips aligned, which may be tough at first. You're really going to have to concentrate on those movements. But again, these are adaptations that you've used to function, and we're going to bring those back and get the stretching where you need it. So leaning to the side, hips stay even, and feel that stretch. Again, keeping the alignment in the body, shoulders are even here with the ear and with the hip. So I'm not swaying one arm forward and I'm not swaying back. Oftentimes when we think that our neck is tight and our shoulders are tight, it could be coming from another area as well. So we want to make sure that all the areas in our upper extremities, in our arms, stay nice and loose. As breast cancer patients and breast cancer survivors, this risk is increased because of lymphedema and because of tightness through the fascia. That's the network that works all the way through the body, but with surgery and with lymphedema, this can become tighter. When you bring in the ergonomic factors of working from a home office, whether it's a lot of keying, mouse work that may be going on, or paperwork, you can be tightening up the muscles that are through your fingers, your wrists, your forearms, as well as the fascia that runs through this area as well. So I want you to make sure to stretch that out. You may be amazed at how tight it is and you haven't even thought about it. So when we're doing this stretch, I want you to make sure, first of all, moving well, we need that alignment. And I'm going to step back just for a moment so you can see the arm coming up to the shoulder with the thumb in at this shoulder level. Now that may be tough for you, but I want you to work on that, and I want you to work on keeping the fingers in a nice neutral position, fully extended, and that wrist in a neutral position as well. So that is staying stable in this position, and the thumb is out to the side as it reaches in to the shoulder. So what we're doing from here is we're just reaching forward, and now we're stretching through a straight elbow. So we have the fingers extended, the wrist in neutral, and the elbow in neutral or with full extension. The arm should be at 90 degrees from the shoulder, and you can feel that stretch. Now, if that is easy for you, or you've worked your way through and you'd like to adopt an alternate stretch, let's add in a little bonus. So we can stretch through the front, but we can also bring this to the side. Now, as we bring this through the side, you'll see that there's stretch through the pectorals as well, And now, to add to this, we can extend the wrist, keeping the fingers straight, and increasing that stretch through the fascia and the muscles on the front part here, the palmar side of our arm. So again, let me show you. We have our regular stretch where we're coming forward, fingers are extended, wrist is in neutral, and elbow is extended, shoulders at 90 degrees, and of course, we're keeping that neutral posture. Now you can either slowly bring this out to the side, feel that change in the stretch as we're engaging a stretch through the pecs. Make sure you keep that neutral posture. If this is fine and you're below that 5, then work to extend that wrist and feel that stretch. Now I have 2 stretches that I'd like you to do while you're seated. I want to make sure, of course, that you keep a neutral posture when you're seated, so ear over shoulder and shoulder over hips. I like to see that your knees are at 90 degrees when you're sitting. That would be ergonomically correct. If you do need to put something underneath your feet, that's fine, as long as you have a position at your desk where you're not moving from side to side very much. Just when you're keying and then having your feet up would be fine to have that 90-degree angle at the knees. But let's go through a couple stretches that you can do while you're seated at the desk. First of all, I want you to be able to stretch out those hamstrings and those calf muscles. Now, I know that there are many breast cancer survivors who are getting cramps and pains through the calves. Not only is it affecting day-to-day, but it's also affecting your activities such as walking. So let's do a stretch that you can have right from the comfort of your desk. What I'm going to do is make sure I'm in neutral, and I'm going to slide on the heel 1 foot forward. Now I'm keeping this knee aligned, I'm keeping my belly button forward, and I'm maintaining this neutral posture. Now, as I lift up that foot, I'm getting an awesome stretch through the calf. Now, just moving that heel forward may have been enough to stretch out that hamstring for you. Remember, we're keeping the hip in a neutral position and staying aligned. Now, if you want to increase the stretch, I'm going to show you from the side. So again, we have our neutral posture. We're keeping that curve in our back. Lifting up those toes will help to stretch that calf. And if I keep that curve and lean forward, I'm getting an increased stretch in the hamstrings. This is important because you're sitting all day. You've got the tightness in those muscles, and you really do want to alleviate the lower body as well. We want to make sure to keep a flow, and we want to make sure we don't get calf cramping. So the mobility, not only in the calf, but also in the hamstrings, is important. So I'm going to show you once more from the side. So sitting in a neutral position, bringing that heel forward. The more I extend that knee into full extension or 0 degrees, the more stretch I get on that hamstring. Toes up are going to increase the stretch in my calf. And if I keep that curve in my low back and lean forward, it's going to increase the stretch in my hamstrings. Remember to do both sides. One of the areas that can get really tight when you're sitting too long, and also as a breast cancer survivor, may be tight because of adapted postures and how you're moving with calf cramps or trying to increase your walking, is in the hip area. So I want to show you, it's a stretch, but it's a mobilization for the hip area. You're also going to move up to a little bit of stability work as well. So let's see how you do with this. Nice neutral posture. We have feet on the ground, knees at 90 degrees, and a nice curve in the low back. What I'm going to do is bring 1 foot forward, and with the heel on the ground and the toes facing up, I'm going to slide that leg out to the side. Now, please note the following. Ears, shoulders, hips are still aligned. Belly button is still forward, and my toes are still up. I can hold this and get a great stretch, and then bring this back to center and pull it back to neutral. So again, let's point this out. I'll try this on the other side for you. I'm going to slide out the foot. I'm resting on the heel. Now I'm really concentrating here that the rest of my body is not moving. That's your core, and that's the stability that we're adding here. And then as I slide that foot out, that's definitely engaging that core and make me consider that neutral posture while it's stretching. Now, I don't want those toes to drop down. I want them to stay up and center. So we get an excellent stretch all the way through. The adductors may stretch. You may feel pulling in the lower part of the calf. So I want you to keep those toes up. If you can't keep them up all the way, you can let the toes drop a little bit, but don't let them roll in or out. That is a hip movement, and we are trying to work on the hip here. Slide that back in and bring that back to neutral. An important factor with your productivity during the day, with getting the most benefit out of your stretches and for relieving stress, is how you're breathing. 2 points I want to make. Number one, when you have shallow breathing, and that's breathing up in this chest area, you're not oxygenating your body properly. Your body is not getting the nutrients that it needs. The other thing that you can be doing is engaging those muscles in the neck. And we do not want to have breathing that requires repetitive movement in those muscles that are already stressed from office work and may already be tight because of accommodations that you've been using to get through the day and to function. I want all the breathing to come down here. I want that belly breathing. The important factor for this too, and the bonus for breast cancer survivors, is that it helps with the flow of lymph through the body. One of the big areas here through the diaphragm is to engage a better flow through the lymphatic system, and that gets cut off when you're only doing the shallow breathing. So I want you to put one hand on your belly and one hand on your chest. I want you to inhale and see which hand moves. If the chest is moving, if that arm, that hand is lifting up, that's the shallow breathing. With your breathing, if you can extend the belly, then we know that we are working through the diaphragm. We are bringing oxygen through our body, and you're also taking that time to rest, to reflect on the breathing, and that decreases the stress throughout the day as well. So one hand on the chest, one hand on the belly. Extending the belly as you breathe and trying to keep the chest from moving. When this happens, when the chest is not moving, automatically those shoulders should not be lifting. This definitely takes patience and time to work on, but it's an amazing benefit that you'll get from this stretch. I hope that I've provided you with some great strategies to help you with the aches and pains and tightness that you're getting while you're working from home. I also hope that you integrate these stretches throughout the day and discover how amazing stretching can be for your body as well as for your mind. As you go through these stretches, make sure to pause, make sure to breathe, and make sure to take those moments for yourself, really being mindful of where your body's at, how it's responding to your movement, and making sure that you give the energy to the areas that really need it. You will be surprised at how efficient you can be with your stretching and how awesome you can feel when your body gets into better alignment because those muscles are more relaxed, more pliable, and you've got better range of motion in those joints. If you have any questions, I am happy to respond. Please send me an email to info@marionbarnick.com, and you can also look for more movement strategies on my website, marionbarnick.com. Good luck with your stretching, with working from home, and continued success with your journey to your best potential.